So everyone, thank you so much for joining Diana's Diaries. We have here our diabetic specialist, Lady Irene. She's a sister to me, and today you pardon me because I came out somewhere, and we will still do it because we have your heart. So regardless, is a plan. We want to be a blessing to you. And I thank God that my lady here, despite her busy schedules and her life routine and everything, she has made it a point, to attend and be a blessing to us. So Lady Irene, thank you so much. Yamisha Opa.
Amen. Oh. I can see you.
So much. So the platform is yours. We are all ready. We've all paid attention.
Okay. Well, thank you for inviting me over, sis. It's always a privilege to be here and share my knowledge and the little that I know. Last time was quite intense.
It was fully loaded.
I've set the bar high. I hope I can maintain it. Thank you so much. It is a privilege.
Thank you.
So tonight, I think we're talking about treatment of diabetes. For those of you who don't know me, my name is Irene. I'm a diabetes specialist nurse. I've been practicing for, I think, 4 years now. Yeah, 4 years now. There's always something new to learn. I'm always learning on the job. Like I said, I'm happy to be here to share the little that I know. Hoping that we can all help each other. And if there's any questions, I'm happy to answer them to the best of my knowledge. Now, we're talking about treatment of diabetes, but I still like to talk about the basics.
Basics,
what diabetes is, the types, because there's a lot of misconception around diabetes, what it is and how it's managed. So first of all, we know that diabetes in itself is a lifelong condition, and it's caused by it's basically high blood sugars, right? And when we say high blood sugars, we know that our body feeds on sugar. The scientific term is glucose. Glucose is our energy, right? That's what we need for energy. It's our fuel, it's the body's fuel, basically. So we do need our glucose, but obviously, like everything else, too much of it is bad. So there's different types of diabetes. There's quite a lot actually, but we focus on the main types, and they are the type 1 diabetes, type 2 diabetes, diabetes in pregnancy, also called gestational diabetes, and then we have what we call type 3C diabetes. So those are the 4 main types, but like I said, there's other subtypes as well. So type 1 diabetes, we know that it's an autoimmune condition. What that means is the body's attacking its own cells. So the body's causing the diabetes. So it's not really caused by external factors. It may be, but there's still ongoing research as to why it actually happens. And we know that with type 2 diabetes, it's more to do with the body's ability to use the hormone called insulin properly. Insulin is the hormone that is produced by the pancreas. The pancreas produces this insulin, and what it does is it's like a key to the door of your cells. So like I said, you need your glucose as fuel, but you need it to get into your cells to be used. So the insulin will open the door of the cell for the glucose to enter, so it can be used. So in type 2 diabetes, we know that insulin is being produced, but it's not working as effectively as it should. And then we also know there's a factor of the body's sensitivity to insulin. So the body's resisting the insulin. So it's not recognizing and using it properly. So type 1 diabetes, we know the pancreas is not producing insulin at all. And then we have like the gestational diabetes, which is diabetes in pregnancy. So normally the woman or the lady doesn't have diabetes prior to pregnancy. They get pregnant, get diagnosed with diabetes. And type 3C is more anything to do with the pancreas, really. So we know the pancreas is the organ that produces the insulin. So if there's any defects with the pancreas, that would affect insulin production, and also long-term steroid use. Now, different types of diabetes have different ways of managing. We know that with type 1 diabetes, because there's no production of insulin by the pancreas, the individual would need external and then with type 2 diabetes, again, individuals can be on insulin, but there's a variety of ways of managing it, depending on, again, individual choice. How good the control is or how bad the control is. Obviously, the most effective treatment we know in the world of diabetes is insulin, but we manage it with insulin as well as other lifestyle changes as well. So I think the number one lifestyle change is diet, which we all know. It's about having a healthy, balanced diet. So like I said, in as much as we want to cut down on the glucose, we still need our glucose because that's our fuel. And a balanced diet is a diet that contains, the main factors and the main ingredients in meals. So carbohydrates, proteins, vitamins. So you want a healthy, balanced diet. So with diets, there's different forms of diets out there. For people with diabetes, we normally direct them to Diabetes UK. So Diabetes UK website is a website that actually contains or has research or evidence-based, information about how to manage diabetes. We don't actually advise, social information from social media, because there's a lot of misinformation there which are not evidence-based. So there's a lot of information out there, about diets and stuff. But generally, particularly with us Africans, we know that we do like our carbs, we do like our rice, our yam, our fufu, plantain, and that's fine, but it's all about portion control. It's how much carbs you are having, right? Now, in the world of dietitians, there's something called the T plate, right? Some of our dietitians where I work, they use that formula, if I can call that. So the T plate is, so you look at your plate, so your plate is round. Now, you're going to fill half of your plate with vegetables, and then a quarter of your plate with proteins, the rest of the quarter with carbohydrates. That is your T plate. That is how much carbs you would have, a proportion of carbs you would have. And normally, the easiest way is a portion of carbs the size of a fist on your plate. Right? That is a balanced diet. And I do know that some of our dietitians as well, they have your vegetables first. So on your plate, you want to finish your vegetables first, then you can have your protein and your carbs, because you know that with that, the glucose or the sugar in your carbs is digested a bit slower. Right? Again, when it comes to carbohydrates, there's 3 different types of carbohydrates. We say mainly 2. So we've got your slow-acting carbohydrates and your fast-acting carbohydrates. The slow-acting carbs are the ones that are digested slowly, right? So when you have a slow-acting carb, the tendency for the glucose to peak, if you do a finger prick blood sugar test, 1 hour after having a slow-acting carb, you find that your blood sugars are not as high as it would if you had a quick acting carbohydrate. So we normally say go for slow acting carbs. It is tough because from our part of the world, we know that we're not so keen on things like whole grains, so whole grain carbs, so the brown pasta, the brown rice. They don't taste the very best, but generally, that if you do have diabetes, that's what we normally say go for, because we find that it's not going to spike your blood sugars as quickly as quick acting carbs would. So your brown, so your whole grains, whole grain carbs, whole grain bread, whole grain pasta, whole grain rice, muesli, in terms of breakfast, or what you have for breakfast, and obviously incorporating them with proteins if you can. So you could have like a slice of toast with an omelette or scrambled eggs, balancing it out nicely instead of having things like a whole grain, or you can have a whole grain bread with and a spread. You have a jam spread or batter spread, so far as you're incorporating it with whole grain carbs, that should be fine. Now your quick acting carbs, you have your cereals, so your Weetabix, cornflakes, Rice Krispies, your white breads, your white rice, your whites, the nice stuff, the sweet stuff. Potatoes, again, we know that that's high in, so it's a quick acting carb, but we actually find that sweet potatoes are slow acting carbs. But again, like we said, it's all about portion control. You still need your carbs. It's a matter of preference as well. So, the books will say have slow acting carbs, but if your preference is white or quick acting carbs, then make sure that you're controlling your portion sizes. So having a balanced diet, going for better options, so going for your whole grain carbs instead of your quick acting carbs. So fruits and vegetables are key. We know that most fruits contain glucose anyway, so your apples, your bananas, your pineapples, if it's sweet, it has sugar in it, basically. Your oranges, but we find that berries are a bit less, and they have less sugar, so strawberries, blueberries, blackberries have less sugar. So you still need your carbs, you still need your banana, you still need your apples, your oranges, but again, it's about the portion sizes, how much you're having. And proteins, you can always incorporate some proteins with these fruits as well. So you can have some banana with some dried nuts, or apples. You can have apple with Greek style yogurt or natural yogurt without the sugar, just to balance it out nicely. So yeah, diet is key. Most people with diabetes will be on treatment, but we don't advise that just because you're on treatment, you can eat whatever you want, really. It's slightly different when you talk about type 1 diabetes. With type 1 diabetes, we say you can have anything you want to eat, make sure you're having your insulin because you're dependent on insulin. But with type 2 diabetes, because it's alive, you want to incorporate lifestyle changes to help with weight loss, particularly the weight around the tummy, because that's what causes insulin resistance. So the fat around the tummy causes the insulin resistance. It causes, or it inhibits the effectiveness of the insulin, really. So it's important that you incorporate healthy lifestyle and healthy eating habits as well. Now, obviously, physical activity as well. So number 2, physical activity. I personally tend to shy away from using the word exercise, because once we hear exercise, we think of the gym. Oh, no, I don't think I can go register with the gym. Or I can register, but I'm guilty of that. I registered, I never attended, right? So it takes a lot of motivation. But absolutely, I would recommend it. I mean, if you do go to gym, if you can go to gym, that's great. Do it. But you start from what you enjoy doing, right? Start from what you can do, like having a short walk even after your meal. Okay, especially now the weather is particularly after your evening meal. It's very easy for us to return from work, have your dinner, and go lie on the sofa, sit in the sofa and watch telly. So you're tired, you've just come from work. But a short walk, even if it's a 10-20 minute walk outdoors, if the weather is okay, or indoors. Most of us would have stairs at home, just walk up and down the stairs a few minutes before you sit in the sofa. It's about setting realistic goals, right? Not saying, oh yeah, I'm going to go to the gym, you're going to sign up and you never attend, which, hands up, I did that. But yeah, realistic goals. Start from the little you can do, and then you can build it up, right? So if you do have diabetes, obviously there's two different types of exercises. There's aerobic exercises and there's anaerobic exercises. Both of them are great, so if you can incorporate both of them, they're great. So aerobic exercises are those that those exercises you use energy to burn your carbohydrates and your fat, right? So things like jogging, cycling, swimming, and you're able to do that for a long period of time because it's using up energy, it's using up oxygen to burn the energy, whereas anaerobic exercises are those that will use a short burst of energy that the body has stored, so the glucose or the fat. So things like weights, the lifting of weights, sprinting, you can't do that over a long period of time because it's actually sucking up your energies. You're burning energy to do that. So both of them are great. So you can incorporate both of them: cycling, jogging, swimming if you want, if you like. If you can do weights, that's fine. So just making sure that you're not doing one type and leaving the other, making sure you're incorporating both if you really do want to keep fit and lose some body mass or body fat, you can call it that. So physical activity is really important, but I would say start from what you can do, what you enjoy doing. If it's having a walk, out there a few minutes after, that's what you enjoy doing. You can do it with your loved one, go out for a walk, come back, and you can build it up. Build it up to jogging in the mornings or in the evening, build it up to cycling, build it up to going to the gym if you can. Just setting realistic goals. So physical activity is important. Number 3, I would say that for those of you on medications, so if you already are diagnosed with diabetes and you are on tablets, you are on GLP-1, so once weekly injections or insulin, just making sure that you're adhering to your treatment. So whatever treatment that your GP or your diabetes specialist has recommended, make sure that you're adhering to it. It's important that in addition to your lifestyle changes, you are taking these medications because they help, right? So there's a variety of medications, there's tablets. I think last time I did explain what some of the treatments do, what the tablets do. So metformin, most of you will be on metformin. Metformin will reduce the amount of glucose that your liver gushes out every now and then and improve your body's sensitivity to insulin. So metformin will help your body use insulin better. Most people are on once weekly injections, so Ozempic, very common, or Mounjaro, it's once weekly injection that helps you to lose weight by tricking your brain to think that you're full, so you end up eating less and thereby losing weight. Insulin, if you're on insulin, please adhere to your insulin, the doses, make sure you're taking them at the right time, taking the right doses. If you have any queries about the doses, please speak to your GP, with regards to the dose titrations. It's really important. Please do not underestimate the effectiveness of these drugs, because they do help. Most of them, like I said last time, they help with your diabetes management, but they will also provide cardiovascular benefits. So they help protect your heart, your kidneys, which are, two important organs. So please, really important. Also, those of you who can monitor your blood sugars, just make sure you're monitoring them regularly. Normally, if you are on tablets, GPs won't provide you with a glucose meter, but obviously you can buy that over the counter if you want. Just make sure you're keeping an eye on the effects of the meal. So if you're really curious about what a meal or particular carbohydrate is going to do to your blood sugars, you can always monitor your blood sugars after you've had that meal. So normally we say monitor it 2 hours, at least 2 hours after you've had the meal. I mean, generally, if you do have diabetes, your 2 hour post meal reading should be less than 7. That's the ideal. So 7 and 10 really we say, but if you really do want tight targets, we say anything less than 7 or 8. And then your faster level, which is the first blood sugar you do in the day, should be less than 7, ideally. So you can keep an eye on the blood sugars, get a diary, put those numbers down. When you go for diabetes checkups or reviews with the GP, you can show them those numbers, just to check your progress, to see how you're getting on, and so you can make informed decisions about the meal types that you're having as well. So particularly, I mean, I would suggest if you're checking your blood sugars after your meals, I would suggest trying that after a meal like white rice. It really does shake you up, because I've tried it before. I've had white rice and I took my sugars like 2 hours after, and oof, yeah, it was a bit scary. Oh, sorry, there's a message down there. No, that's fine. So yeah, it's important that you keep an eye on your blood sugars. Very, very important. If you have any queries, again, discuss that with your healthcare provider, your GP. Tips: smoking. Smoking keeps you or puts you at risk of cardiovascular diseases, like strokes, heart attack. So if you're a smoker, we do advise that you minimize the smoking and eventually stop it if you can. There's help out there on how to quit smoking. There's information online about how to quit smoking as well. I always say it is possible. Everything is possible if you do set your mind up to it. Alcohol, again, we know that different types of alcohol have different effects to blood glucose or blood sugar levels. Things like beers, ciders, they're high in carbohydrates, so they may cause blood sugar peaks. But then they also have the tendency to cause low blood sugars, because most often what alcohol does is it rids your liver of the glucose storage, and that can cause low blood sugars. So just being mindful of the alcohol, the portion of alcohol that you're having as well. Bit of wine. Again, preferably if you can avoid alcohol, I will say avoid it. But obviously it's as per choice, really. Just minimize how much, or your alcohol intake, just minimize that if possible.
Can I ask a question now?
Yes.
When you were coming on, there's a gentleman. I'll ask the ladies one first. She is she's got diabetes, and she normally goes high, and she wants to find out how come, like most of the time. There was last time she said her children rushed her to the hospital because like she couldn't see herself in the, like she was dead. But she's type 2, so she wants to find out how come she normally goes on hypos and what can she do to manage it so well. I think so sometimes it was keeping it during the mommy, but you really, I'm not a specialist, but the little that I know, that's mommy, do you really take your medication? Like, do you really routinely do this religiously. Oh, I kind of pray and I'll ask the question for her, and if there's any way that
I mean, it'd be good to know the events that lead up to the hypos, and it'd be good to know what treatment she is on as well.
She's on metformin at the moment.
Okay.
On metformin, and her eating, they've given her a regime to follow. But the way you were saying, like we love our carbs and all that, she's not strictly following it. So is there any way, like genuinely, how people who are on medications can adhere to their medication and also eat right and respect the fact that diabetic nurses has given them this kind of procedure, say something to be religious about.
I mean, with hypos, it's really the other way around. So with hypos, it's low blood sugars, isn't it? So we say anything lower than 4, so 3.9 going down is a hypo. Now, metformin in itself does not cause hypos. We know that there's other tablets or insulin causes hypos, but metformin in itself, the mechanism of action doesn't cause hypos. However, if an individual is still having hypos if they're metformin, then it's probably worth checking their HbA1c. There's obviously the GP to do that, to check if they actually do need treatment. Because although it doesn't, technically or directly cause hypos, if the hypos are happening, then do you need the treatment even? You don't need it because your sugars are stable enough to even cause low blood sugars. So first of all, I'll say she probably needs to have a review with her GP surgery nurse or GP, just to check that, she's on the right medication, or to check if we need a reduction of the insulin, of the metformin, or to check that the kidneys are working fine, because most often once the medications are excreted by the kidneys, if the kidneys are not functioning properly.
You guys, don't you review their medications? Because if somebody has been on metformin and it's been acting like this for a year, she needs to see a doctor for them to review, like you are saying. And maybe they can tell her to stop for a while or something, because
if needed,
visit the hospital, she's just taking her medication, eating right, and before it was high, before it was no hypos and stuff like that. But for the past year, it's coming down, so that means she's eating right, or she's doing something.
I mean, potentially, her diabetes control is better, potentially. But the only way for her to know is for her to visit her GP to get a blood test. So if she hasn't been, usually we say the GP should be bringing you in at least once every year. Once every year for routine follow-ups or routine checkups. So if that's not being done, she should get herself checked in. Unfortunately, we find that most GP surgeries are not doing that. They're not bringing people in routinely, particularly if you're just on tablets, on insulin. You don't get that routine review. So I personally think she needs to get herself checked in. Now, in terms of hypos, some of the causes of hypos are dietary related. So again, remember in the beginning I said, again, you want to cut down the glucose levels. However, you need your glucose, right? So some people may wake up in the morning, have their breakfast, right? So they may have, and I want to bring this down to our part of the world. So because most of us are not breakfast, we're not keen on breakfast, we may wake up and probably have something like rice for breakfast or for brunch, right? So we may not have something to eat before, say, midday. We always skip breakfast and have a midday meal and, call that breakfast, call that brunch. And we may, in between that and our evening meal, we may not even have any snacks. We may just starve ourselves all the way through to the evening when we return from work. It's about 7 o'clock or 8 p.m. So just bear in mind, you've had something to eat for midday, all the way through to 8 p.m. You've had nothing to eat, and you're on your feet, you're working, you're up and down. If you have diabetes, it's a tendency you're going to have a hypo in between, because you do need your glucose to sustain you. And unfortunately with diabetes, because the mechanism of action is with your pancreas and your liver, and there's another action of the liver where if your blood sugars are low, your liver is kicking in to give you some more glucose, or releasing some glucose into your bloodstream. So dropping your sugars. So my advice would be, obviously, first of all, to get herself checked in at the GP surgery. In the meantime, if she's not snacking in between her meals, or if she's avoiding carbs, she needs to start incorporating carbs in her meals and having snacks in between, like, could be a small size or medium sized banana in between breakfast or lunch and your evening meal, or have some berries, strawberries, blueberries, blackberries, or have a small size or half an apple, something that's gonna sustain you. Now, with hypos, usually your body should tell you you're having a hypo. You start getting symptoms, like feeling shaky, tingling of the lips, palpitations, headaches. So some of the symptoms are very specific. But unfortunately, what I'm going to assume is, because she's on metformin, she hasn't got a finger prick machine, or she hasn't got a glucometer to test the sugars. Because normally what we say is, if you get any of these symptoms, test your sugars, do a finger prick test. Now, because she probably hasn't got that, if she does get any of these symptoms, what I would suggest is she has a snack, a carbohydrate-based snack, a banana, apple, a couple of biscuits, something that's going to sustain you, that's going to give you some sugar, basically, right? On the other hand, what I would suggest is if this is an ongoing thing, then probably speak to the GP, get a glucometer, finger prick machine on the go if she's getting any of these symptoms, to test her sugars. It'd be good to know whether she drives as well, because if she drives, she could have her license revoked if she has a similar episode behind the wheel, because you're putting yourself at risk, you're putting others at risk as well. So if she's having regular hypos, it is quite critical. She needs to get herself checked in, ensure she's on the right treatment, make sure she has snacks, on the go, make sure she has a glucose meter, she's testing the sugars when she gets any of these symptoms. Now, the way to treat a hypo is, you want something that's going to bring the sugars up within 10 and 15 minutes, okay? So if she gets any of these symptoms, she does a blood sugar test, and the sugars are below 4, she wants to have anything like 200 mils of orange juice, so little boxes of orange juice, 100% concentrated orange juice, or 5 jelly babies, or full fat, Coca-Cola, Fanta, 5 fizzy drinks, so full fat fizzy drink, or some people would use any form of juice at all, so apple juice, or you can get some over-the-counter hypo treatments like glucose tablets, glucose shots. So have any of that. So have your orange juice, for example, if it's that, and then you're going to test your sugars again 10 to 15 minutes after, to ensure the sugars are going up. Now, if it's gone above the 4, so if you've treated your hypo, your blood sugars are 4 and above now, then you can follow it up with a snack, so like a couple of biscuits, a banana, an apple, or just have your next meal, your carbohydrate-based meal, once it's due. Now, unfortunately, sometimes because you've had diabetes over a period of time, or because you've had a series of hypos, your body loses awareness of your hypo treatments, your hypo symptoms. So you may not feel the symptoms of a hypo until you've actually blacked out. Right? The symptoms you get, like the shaking, the tingling of the lips and all of that. They are early warning signs of hypos. And like I said, your body feeds on glucose. So with hypos, what it means is that your body needs glucose. Now your brain typically feeds on glucose as well. So you want to treat the hypo in its early stage before it gets to the later stage where it's affecting the brain, where your brain lacks glucose. That's where you end up with loss of consciousness, being aggressive. For some people, it's a seizure, you know. So it's hypo is quite critical. So I would suggest you get yourself checked in. It's very important you get yourself checked in to ensure that she's doing the right thing.
Ladies, how are you all doing?
Hello, Mommy. Thank you so much, Mommy Venice, for coming on. Thank you so much.
Just want to tell you that you guys are doing amazing, amazing. Very educative. I've shared the live to a lot of people, and I hope they are all learning. I mean, this is such a fantastic opportunity to be here to, learn about diabetes, because diabetes is such I don't know what the word to use is. The illness is so bad. I mean, don't get it. Do whatever it takes to prevent you from getting diabetes, because if you're diabetic, long-term medication, also, the side effects, like sometimes it affects your kidneys and all that. So I always tell people to try and get themselves checked out. Like I was asking for a lady asked me of this Manjaro, this thing, that is it good, because she was told that she was on the borderline of getting diabetes, because she needs to lose weight, blah blah blah, and she's been trying, when you get to some of us our age, and oh my God,
You're a busy woman.
We understand everyone.
We that knows.
And she said she's tried everything, and somebody advised her to go for the Manjaro. So I was asking, the lady was on actually, so I was asking for, is it very good? The side effects, what are the side effects? Because I think she said that will help her lose the weight and eat properly. That I don't know how it works, but if you can educate some of us
with how the Manjaro works.
Yeah. Because actually I have two people. One is a guy and one is a lady. The guy is diabetic and hypertensive, and also his BMI is very high. He said he called his GP, because I think it's on the medication is on prescription now. So he asked the GP, and GP said he has to have about 5 illnesses. How ridiculous is that? We're trying to prevent people not to get all these illness, but they said you have to have all these illness to be like eligible for these Olympic. Oh yeah. And it's expensive. Some of them are like 150, 200 pounds. Not everybody has that kind of money. Do you understand? So I don't know. Jesus Christ. How these people know that I'm on live?
This is weird. Wow. Wow, thank you, Mommy Venice. Thank you so much. I think Lady Irene, our specialists, have heard you. But Mommy, the medication that previously you were selling, what was the name again?
Juice Plus. Juice Plus.
Yeah, lady.
I'm going back on Juice Plus because, well, actually, I've started Juice Plus. I'm doing it at home. I use the shakes, the protein shakes, twice in a day, and I have one meal. one proper meal, but healthy.
Mm.
You remember I lost 2020. I lost quite a few.
Yeah, you know those there's a lady that was also doing that was diabetic, and also she was having some side effects. So I wanted to ask Irene with regards to that, if someone has that condition, because she said she was buying it because she had that. Someone said that it can help it,
No, it's very good. It's very good for diabetic patients.
but for
We were
her,
educated.
Are we talking about
Yeah. Not only with the juice plus, it's not only the shakes to lose weight, is the protein, sorry, the oh, the capsules. We have the omega blend, the
so
three
I'll
vegetable.
let Lady Irene answer your first question with regards to the Mandura. Then we will come to the juice plus, because it's another question that the gentleman wanted me to ask for him.
Okay.
Okay, mommy.
I don't know much about the juice plus, but I do know about the Manjaro. Manjaro is an effective. So Manjaro is a hormone. The medication in the drug is called Zapatide. That is a hormone. We call that an incretin mimetic. So what it does is it tricks your brain to think that you're full, right? So you may have 2 or 3 spoons of a meal and you have to stop, because if you don't stop, you will throw up, right? And that's how it works. It's a very effective medication for weight loss. The science that backs it up, research backs it up. Statistics are quite good in terms of the outcomes in weight loss management, and also helping with, diabetes control. Because we know that if you can lose weight, particularly in type 2 diabetes, if you can lose weight, that will eventually improve your HbA1c, which is your diabetes control. I personally know people, patients, that are on this drug and they're doing really well. Now, Manjaro is out there on the black market. It's also available on prescription, but on prescription is only available for those with diabetes, type 2 diabetes to be precise, and also available for those with a BMI of 30 and above. So these are the 2 criteria: high BMI, type 2 diabetes. Now, I'm not sure why was it him or her GP was mentioning all these other conditions that he has to take prior to go to Manjaro. I'm not sure. I mean, for the information that I'm aware of,
Before you qualify to have the Manjaro, you need to have certain conditions.
I'm not sure because we do have the representative. So a few days ago we had the representative from the company, Lily, come in, and he didn't mention any of this, right? So what we've been informed, the information we have is you have to have type 2 diabetes, you have to have a high BMI to qualify for Manjaro on prescription. Now, side effects to Manjaro are mainly gastrointestinal related, so nausea, diarrhea, cramps, constipation. Obviously, if you can tolerate those symptoms, and you can maintain the doses. So obviously you start with a maintenance dose and then build it up. Once every week you have that injection, you have 1 dose for 4 weeks, and then you build up the doses every 4 weeks, really. So the starting dose, I think it's 2.5 milligrams. Was it 5 milligrams? 5 milligrams. And then it builds up eventually to a maximum of 15 milligrams. So if you can't tolerate it, those symptoms are manageable. They can be manageable sometimes. So if it's nausea, trying natural remedies like ginger. So ginger helps with nausea, or over-the-counter anti-sickness medications. Diarrhea, we know you can get over-the-counter diarrhea medications. So there's ways around it. Obviously, if the symptoms persist and they're a bit severe, we normally say you're probably just not tolerating it then. But most people I know are able to tolerate the symptoms, and go on to
Yeah, you're right. I think the first dose, I know somebody who uses it. I think the first dose starts with 2.5, and then after 1 month it goes to 5 milligram, and then 7.5. I don't know if it goes higher than that, but yeah. Yeah, if you can find out, you can find out from the GP. They made it really hard for people because they know a lot of people need help, but the medication itself is quite expensive. Because I think the 2.5 starts with, some people sell it in is it Medix Express or something? They sell it for 100, and then 5 milligram is 150. And if somebody sign you up, 150.
Hey.
So they can't give it on prescription because the whole country will go for it. Because once you get to a certain stage, your metabolism slows down. I even said to my family, I said, mine stopped. Mine stopped because the weight is not coming on. So I'm trying the Juice Plus because I've done it before. And I lost a lot of weight. You see, I started posting my previous pictures. This picture here is actually, I took it around 2017. Yes, and this is where I want to get to. That's why I post the pictures to motivate me. Do you understand? So if you're on here, this lady has been really, really good to educate us on diabetes, because diabetes is deadly disease. Trust me, believe it or not. I work in the hospital. I work in the Royal London Hospital. I work in dialysis place. I work in a whole lot of, you name it. And I've seen what diabetes can trigger the body to. And so we need to, take precautions so we do not get into this unfortunate disease called diabetes. It's such unfortunate disease, honestly, because what it can lead to, it's so many things which you won't be happy with. Yeah.
Thank you. Lady Mommy Benis, thank you so much for coming on to share your view.
Thanks for having me.
Yeah, God
bless.
bless.
Thanks for having me. Bye bye, everyone.
Bye. Lady, so with this Manjura, do you guys give it to patients on admission, and when they are going, you discharge them with it as how much? Today is the first time I'm hearing is this expensive.
It's very popular now. No, we don't. So that's mainly the duty of the GP to start people on it, because of the side effects. We don't tend to start in hospital because we don't want things to go wrong, right? We start taking it and start feeling nauseous, so in the toilet every 5 minutes. No, it's the last thing we want to do when someone's in hospital. So we normally recommend for the GP to start someone on it if they do qualify for it.
But you mentioned that it's very effective too.
Yeah, the numbers are there, the statistics are there. I personally know people that are on it and they're doing really well on it. It's quite good. But it's at the moment it's available for people with type 2 diabetes. That's the criteria. So anyone else that hasn't got diabetes that is getting it outside of prescription. Can't comment much on that, but yeah, as a diabetes nurse, for someone with type 2 diabetes, I would recommend it if they do tick the boxes. So high BMI and having type 2 diabetes.
Wow. Thank you. That is very well explained, and thank you so much for this knowledge. I hope our sister has been answered. Any more questions before I ask the other one for my lady? Let me go through it. Nice topic. Well done. Okay. So my other question is for the gentleman, Rini. I'm so pleased with your answer. And I like the fact that, when you spoke about the Juice Plus, with the Juice Plus, I don't know much about it, but the lady was asking me how it works and all that. And I like the fact that you are being honest here, saying that, you know, it's not in your field. You haven't given anybody any juice plus, so you can't talk about it. I also can't talk about it because I think it's giving her side effects and some things like that. And I'm like, you need to go and see a specialist. And she said when you come on, she can describe it to you and how she feels. And I was trying to tell her that I think she needs to speak to a specialist like you, and see how best, you know, she can manage it, because she can't just leave her medication and just depend on the juice plus. Or what's your take on that?
Wow. From a health
But
professional,
they said it's going to cure it. On say with those BBJO people
yeah.
depend on it when they hear that traditional medicine. So she's the type that when she wanted to go, obviously nobody wants any kind of illness that is, you know, permanent in your life. You need to resource on medication and medication. So when she hears of herbal medication, she stop whatever that the doctor has given her and resorts to that. And now she's heard of this juice plus, or sorry, on to maintain. So she's like, let me see if she's on I don't know the list. Anyway, so she want me to ask for her because Ghanaian on to me expressing Sebio. You know, please, what is your take? Even though you don't know anything about juice plus, do you recommend that she should be going back to her own medication and those traditional medicine? No, should she continue doing it? Because me diabetic neck, I'm a genuineness, I'm an adult and I'm baby. Now that we have the opportunity to have you there, a lot of people want to come and hear you. And who say specialist Abadia Diana, please, I've seen her on your flyer, and the other time I learned a lot from her. I want you to ask her for me. Do I have to continue with my juice plus, or what should I do? So please, a little bit for her.
Well, like I said, I don't know the indication for the G plus. I mean, it would be good to have someone that actually knows the drug, because I don't know it. So I can't really comment on it. I can only comment on what I know, which are the diabetes medications, obviously the lifestyle changes.
Yeah.
But I do believe in the effectiveness of, you know, our local herbs, because they do work. They do work. But again, from a diabetes specialist nurse point of view, I wouldn't suggest stopping recommended medications from a GP or from a healthcare professional, and resorting to other medications that obviously we do not know about. Implications of mismanagement of diabetes can be really fatal. So we're talking about strokes, we're talking about heart attacks, we're talking about, you know, losing a toe, amputations, we're talking about, you know, chronic kidney diseases where you end up on dialysis. So they are pretty fatal, and we strongly believe in achieving optimal diabetes management control, because we know that with that we can prevent the complications later in life. So my advice, again, the suggestion would be, I'm sure the juice plus comes with a leaflet. It talks about the indications, ingredients, you know, side effects. So it's probably worth it having a discussion with your healthcare professional. So pop into the GP surgery or speak to the diabetes specialist nurse in your community, taking the medication, taking the leaflets, and have a discussion around it. You know, what's in there, the effectiveness of it, but ensuring that you do not discontinue your diabetes medications unless you've been informed, told so by your GP before your diabetes nurse. That's what I would say.
exactly what I wanted to say about me. I'm not a specialist, so I said, let's hear it from your own mouth. So at least I'm happy. You can't stop your medication and say that you are resorting on something else without, speaking to a doctor or a specialist about it. You've gotten traditional medicine, and you've read about it. If you've read about it and you've spoken to your doctor and your doctor says it's okay, then fine. But I wanted you to give your honest opinion, and I'm happy about your answer. Thank you so much. Thank you so much. I also want to ask, hey, and I'm me this a question. So who somebody wanted to come on? Let me see. Hey, Daddy Obed. Reverend, you are welcome. Daddy is on. Lady Sylvia. Yeah, I think Dickness. There's a lady that wanted to come on. Dickness.
Hello, good evening.
Good evening, my sister. How are you?
I'm blessed by His grace.
Oh, our
How are you
specialist is here for
too?
you. I'm okay. I'm all right, my darling.
We thank God. Thank you so much, sis. Very nice and educative topic there. I was not the one that requested to come up. I think it was Sister Benny's that requested to come up, but it's a very interesting topic. And I would just like to share that, for people that are on medication, they need to work along with their healthcare professional, because they have to kind of monitor you. They need to monitor the range. You have to keep track of your blood sugar level and everything, and then they can also do the test. They keep check regularly. So if you stop your medications and just say, oh, you are on some particular maybe juice plus or whatsoever, it can be very risky. It can be very risky on your health if you are not working alongside your GP. And also, what I also tend to also notice sometimes is that people tend not to go to the GP. People don't want to go to the, to see the doctor, because I don't know, for whatsoever reason to them. But if you go regularly to go and see your GP, they can do these checks for you. They can, I remember when I had gestational diabetes when I had my last baby, and I just went to the GP. I think after a year or so, they kept monitoring me. They did a blood test, and then they said I've got pre-diabetic. Okay, so I went back when my son turned 4 to just say, okay, let me go and check again. So imagine if I didn't go back to the GP, that means it can also progress to diabetic, because I just took that, this child is 4 years old. The GP did not write me to say, oh, let's check again. So I just booked an appointment and I just went to the GP saying I had gestational diabetic. I was told after, the blood test when I had the child, when they did the HbA1c, that I'm pre-diabetic. So I just went back 4 years. When the child turns 4, I said, am I still pre-diabetic? Can you do a blood test? You see, and then they did the blood test, and then they said I'm still pre-diabetic. I'm sure you know a little bit of my healthy eating and healthy lifestyle. That was why I just went, you know what, if I didn't go to check, that's how it could progress to diabetic, because I'm already at the borderline. Then I took it upon myself and I started, eating healthy. I cut down on whatsoever that I needed to cut down, and then knowing all my other medical history as well. So I'm like, if I don't look at this, so people need to take their health so seriously. Don't wait until when things get out of hand before going to the GP, before going to the doctor. Just go, maybe once a year. Just go, ask for blood tests. They will do it for you, and then at least you will be able to know. And for those that are on that are already diabetic and they are taking medication, don't stop your medication completely, saying that you have other alternatives without working alongside with your GP or with your diabetic nurse for them to keep track and just keep checking and for all these things. Because when you are doing all these things and you stop your medication, it can be very, very life-threatening, to be honest. But when you walk along your GP, they can reduce it. If you are on whatsoever medication you are on, they can start reducing the doses, start reducing the doses until they say, okay, you know what, we're going to stop it. You are okay, and then we keep reviewing you. So people shouldn't be ignorant, please. Just keep checking. Take your health very seriously. It's very, very important. Thank you so much.
Wow. Thank you, Ness. Thank you so much. I appreciate your contribution. Lady Irene, I want to ask the last question. I know of your time, is taken. We appreciate it. I'm not going to leave you on for long. There's another patient as well that, has a wound and he's diabetic. But the problem is that the wound is not going, and you and I know how. But his problem is that any reason why his wound can be like any other normal wound that we treat because it's been there for 5 years and it keeps getting worse. What is your advice and what can he do to make it better?
We know about the complications of diabetes, right? So I always like to bring it to, just liken it, metaphorize it to things that we actually know. So take it a concentration of glucose, right? So say you've got a cat and you fill it with half a jar, half water, and then you add in a concentration of sugar, right? You're going to have a very high sugar concentration, and if you leave it sitting there, it may start getting thick. And that's what happens if your blood sugars are not in control. The glucose needs to go into the cells to be used. But in type 2 diabetes, because your body is not using up the glucose, all of that sugar, most of that sugar, sitting in the bloodstream, roaming about, just having a jolly filled day, having a party in the bloodstream. It's gonna thicken you. Into your hand, into your brain, into your hand. When you have a diabetes foot wound or diabetes foot
I think, Irene, sorry, you were muted. We couldn't hear. Now it's okay. They said we missed it. Oh, it's good now. Yeah. So we miss it, please. It was very interesting. We were learning.
So if you have a diabetes, so say you have because already you don't have good control, right? Your blood is thickening up, yeah. So all the vessels, so the veins, the capillaries that are supplying blood to your feet are restricted. It's thick, so you don't get the nutrients that you need to go into that foot. Because normally you'd have, substances in your blood that will help your wound heal quickly, your platelets, right? The nutrients, the vitamins that help, the wound heal quickly. Because you have diabetes and you're not getting a good supply of blood to your feet, and you've got a wound or so on your feet, it's not going to heal because you're not getting what you need to make it heal. You're not getting your vitamins, you're not getting your platelets, so it won't heal properly. Now the only way, most of the time what you find is it's a bit too late because the patient's had, diabetes over a period of time. They've had not so good control over a period of time. So the damage is done already. We can't do nothing about it. We find that they have a sore, it's not healing properly. Some people end up with amputations. But if it's been caught on time, what we can do to reverse that is good diabetes control. Getting all that glucose, or most of that glucose, into your muscles, so that it's not having a jolly filled day in your blood vessels. So what you may find is, if you've gotten to that stage, what you need is insulin injections, because it's going to lower your blood sugar levels. Then you're going to have, the nutrient supply going freely to help your feet or your toes or whatever, heal quickly. But in like someone saying, nutrition is pretty vital as well, making sure, and it all encapsulates healthy, or optimal diabetes control. So like I said earlier on, making sure that you're eating right, you're losing weight, you're taking your medications, as prescribed. So it's important that you have good diabetes control. So it will be worth it, again, that he checks in with the GP if he hasn't done that in a while, to check what his HbA1c is and have discussion regarding the treatments or the lifestyle changes that are going to help his HbA1c control come down and eventually promote the healing. Good diabetes control. That is the answer.
So much. Thank you very much. A successful time with you and very educative. Anybody with a question before we let our specialist go and have a rest? It's been a long day for her. It's getting to 10:21. Any last question? Mommy Benis, I'll let her come on again, so that at least you can explain the Juice Plus to whoever want to hear. But at the moment, she's for us. She's promised us that anytime we have a worry, we have any issues with regards to diabetes, she's here for Diana's Diary. So yeah. Someone said, God bless you, Irene. Oh, that was very informative. Thank you so much, my dearest sister. Thank you for your time. Thank you for your knowledge. May God bless you and keep you. Please, your last remarks for someone who hasn't gotten herself into in this kind of condition, and someone who is into it. So your last remarks for someone who have the diabetes and someone who doesn't have it, before you go.
Summarize it all. If you have diabetes, make sure you're eating well, make sure you're losing weight that you're meant to be losing, make sure you're taking your diabetes medication, make sure you're speaking to your healthcare professional. Also, if you're on a medication, make sure that your GP is checking that you're on the right track, that your blood sugar levels are okay, that you're on the right treatment. It's very, very, very important. If you don't have diabetes yet, please don't get it. Do not get it if you can. Again, healthy lifestyle, healthy eating, just make sure that around the tummy it's the issue. So you may find that some people are actually okay, so the arms are okay, legs are okay, but it's the back that we're coming around the tummy. That is what caused the existence. So, healthy eating, make sure we're eating right. Just watch your portion sizes, how much carbohydrates you're having. Make sure you're having a balanced diet. So, less carbohydrates. Remember, a portion size of carb is the size of your plate in your plate. All the rest of your plate with vegetables and proteins. Make sure you have a healthy balanced diet. Weight loss.
Thank you so much. So we all had her. If you haven't gotten it, don't go there, don't go near it. Healthy lifestyle, it's all that we are all craving for. Let's try and eat healthy, and those on medication, let's stick to our medication Let's take them religiously. It's Diana's Diary. Hope to see you. We've got interesting and educative personnel coming to grace the platform tomorrow. You don't want to miss it. It's all about career progression. Let's meet him at 9 p.m. And God bless you, Lady Irene. Thank you so much, darling. I love and appreciate you for your time and your dedication. Yamin Shao.